Welcome to Planet America's Weekend Edition, coming to you from the Situation Room. I'm John Barron.
I'm Licciardello, and we've got a situation.
Goals and reflects.
He's been actively seeking to discredit the effectiveness and safety of the MMR vaccine. You know, with Mr. Kennedy, it's every few days he comes up with something new and outrageous.
We'll be talking to Dr Peter Hotez about the impact of RFK Jr.'s lukewarm support for the measles vaccine.
Economist Justin Wolfers is going to look at the economic impact of American girls getting fewer dolls. And Melina Wicks will be here in the briefing room. But first...
Now, if you're having trouble keeping up with Trump's tariffs, don't worry, you're certainly not alone. Since returning to the White House in late January, Donald Trump has made a dizzying array of announcements, threats and pauses, more than 50 in total, including April's Liberation Day global tariffs, which remain suspended pending individual bilateral agreements, apart from an across-the-board baseline of 10% on all imports to the United States. Hot on the heels of last week's much-hyped trade deal between the United States and the United Kingdom, which was, quote, light on details, and analysts concluded did not appear to meaningfully alter the terms of trade between the countries. This week, the White House claimed to have secured a China trade deal, winding back spiralling tit-for-tat tariffs for 90 days after weekend talks in Geneva. US Treasury Secretary Scott Bessent was upbeat in a low-key kind of way.
We concluded that we have shared interest, and we both have an interest in balanced trade.
Bessent acknowledged that tariffs of 125 to 145% were not sustainable for either the US or China and would have led to a decoupling of trade between them. While markets rallied on the news, this is not a deal. It is an agreement to allow a 3-month window to try and negotiate a deal. And there is still a 30% tariff on Chinese imports into the United States and a 10% tariff on US imports into China. The clock is ticking. If an actual deal is not done by August, then the tariffs go all the way back up to 125 and 145% again. Meanwhile, for the rest of the world, that standard 10% tariff on US imports remains, with higher rates for steel, aluminium, cars and car parts.
And Trump is still promising more tariffs on electronics and pharmaceuticals at least. Yeah. So there's more coming down the road. I do disagree with a little bit on the idea of the UK deal being totally insignificant. I mean, it hasn't changed much, I agree with that. But it did establish that even in a trading relationship where America has a trade surplus, which they do with the UK, they're still going to insist on that 10% tariff. I mean, America was desperate for a deal with the UK, or in fact anyone at that point in time, but even then, they insisted on maintaining that 10% tariff. And according to Caroline Levitt, that's how it's going to be for everyone.
The president is committed to the 10% baseline tariff, not just for the United Kingdom, but for his trade negotiations with all other countries as well.
Permanently, even after the deals are done, like that is going to remain.
The president is determined to continue with that 10% baseline tariff. I just spoke to him about it earlier.
And on that note, 10% sounds like small change. It sounds like a relief after we've been talking about tariffs of 145%. Sure. But that's still actually a very high tariff as far as tariffs go, as is the 25% on cars and steel. When you add them all up, even after the rollback of China's tariffs, the effective US tariff rate has risen from around 3% at the start of the year to 14% now, which until this year would have been the highest tariff rate since the 1930s. It's high. And I've got 2 questions for you, John. First question, what's been achieved here with all this up, down, left, right? We don't know what's going on. I thought the whole point of this was to isolate China. That's what they said. That's what they promised us. It was about China's unfair trade practices and their intellectual property theft, trying to address these kinds of issues. It seems like they've achieved all kinds of damage without achieving any concessions from China whatsoever in these critical areas.
Oh, look, some of those other non-tariff issues may get addressed as a part of the negotiation, leading to a deal to lower tariffs. It seems to me as though Trump blinked in the face of China standing up to a bully. They simply said, OK, you want to put tariffs into the 100-some%? We'll see you there. That's the problem when it doesn't matter how rich you are, if you sit down at a poker table with somebody who's at least as rich as you, which is what China is and what China's president is able to do, they called Trump out on all of this, and faced with the reality, the implications of what that decoupling that he was talking about was going to do in terms of American consumers and trade with China, they said, well, we better just call the whole thing off and try and do a deal. Now, Trump typically goes for this maximalist approach. He did it in his real estate career. He does it when he's negotiating with TV networks for his show The Apprentice. He makes these ambit claims that are ridiculous. You never quite know, is he serious, is he not? He puts things on the table that are outrageous. They get taken off again. Was he joking? Is this a ploy? Nobody really knows. He keeps people, a little bit confused, as we all have been for the last few months. But at the end of the day, China said, OK, we're going to ignore Eric Trump's advice to immediately make a deal and don't put on reciprocal tariffs, don't increase your tariff rates. They said, I'll tell you what, how do you like dem apples?
Yeah, I suspect as well the embargo on rare earth exports from China, that really played a role because America just can't get them anywhere. I don't think Trump realised just how much leverage China has.
Yes.
Because you've got a situation where America literally cannot manufacture critical materials because of the lack of rare earth metals. And I think that was just about to bite, so that's why he might have backed down. My second question to you is, have they stopped the damage before it started? Because we've been talking about this for a while now, but this week was the week that the port slowdown finally arrived. Long Beach saw a 35 to 40% drop compared to normal cargo volume. The Port of Los Angeles had a 31% drop in volume. On Wednesday, Seattle had 0 container ships in the port for the first time since the pandemic. And that article that I just quoted was published the same day as the China tariff back down. So, and at the same time, I should add, Trump received some good news, at least economically, which was the annual inflation rate came out for April. And it was lower than experts expected. In fact, it was the lowest rate since February 2021. And that you put that next to the March inflation rate where there was deflation. And so far, the tariffs are not filtering through to the inflation rate as much as people were doomsaying that they might. Yeah. At least so far. Least so far. And so when you put that all together, that the inflation rate hasn't gone up yet, and they've backed down just when the shortages began on the ports, have they turned the car around in time?
Well, retail giants like Walmart have said, we're putting up our prices. Even with this 90-day pause and the 30% holding tariff rate, they have to pass it on to consumers. So the important thing when we talk about consumers here, Trump sees them as voters. This is a negotiation with them. This is a negotiation not just with China, but with public opinion. At the end of the day, Donald Trump is imposing a tax on the Americans who are buying Chinese imports. This is a tax on American consumers. He wants them to think that this is China's fault. This is Britain's fault. This is America. America's trading partners are still ripping you off. Our prices have gone up, but they haven't gone up as much as they could have done. So this is where, similarly, it's, Trump probably doesn't mind the gloom and doom predictions of how bad things could get if they're not that bad. People say there could be a recession this year. Well, if there's not a recession, he looks like a genius. He's the one that created the situation where anyone was talking about a recession. We can now see from that same economic data, the American economy was in fine fettle in January until Trump came along, and now it's gone a little bit pear-shaped, and goodness knows where we'll be in 2 months from now.
And that's all in return for not that much as far as tariff collections go. There was $16 billion collected in April. It's not that much for all this chaos. Although I do want to say something. A lot of people have criticised Trump for backing down. They said, oh, how weak, he's backed down, he's snivelling, all that. Like, they've been very negative about it. I actually think, look, give him credit for backing down before he really committed suicide on the economy. He should be criticised for ramping it up in the first place.
He ended the fight, but he shouldn't have started in the first place.
Exactly. And I think you criticise him for starting the fight, but ending the fight, that's a good thing. And I'm glad he did that. And especially given that really shows up the lie of his rhetoric to date. Because until now, he's been actually arguing that the slowing down in trade was somehow a good thing.
Because business has slowed down, as you mentioned, we're seeing as a result the ports here in the U.S. the traffic has really slowed, and now thousands of dock workers and truck drivers are worried about their jobs.
That means we lose less money. You know, when I see that, that means we lose less money. Look, China was making over $1 trillion, 1.1 trillion, in my opinion. You know, different numbers from 500 billion to $1 trillion or $1 trillion. I think it was 1.1 trillion. And frankly, if we didn't do business, we would have been better off. Okay, you understand that. So when you say it slowed down, that's a good thing, not a bad thing.
By that logic, he shouldn't have reduced tariffs at all. He should have increased them to 300%. Of course, that's not true. As soon as things started looking scary, he backed down. And that just proves that his broader tariff story is not true.
Yeah, and we saw his tell there as well when he says to a reporter, you understand that, you know that. That's when he's lying. For more, we're joined by one of the leading economic commentators in the United States today, who just happens to be an Australian, Justin Wolfers, Professor of Public Policy and Economics at the University of Michigan. Professor Wolfers, welcome to Planet America's Situation Room. I wonder, we've been talking a little bit about Trump's comments about girls having to have fewer dolls and not as many colouring in pencils. As an economist, from an economic standpoint, what are the implications of consumer demand dropping for those kinds of items because retail prices have gone up as a result of import tariffs?
John, I'm going to rewrite your question for you to make it a little bit clearer. He's not actually going to directly regulate the number of dolls that we have. What he's saying, though, is that his tariffs are going to cause prices to rise, and they're going to rise in a way that are going to lead families to be able to afford less stuff. In an attempt to trivialise it, not to mention feminize it, thereby further trivializing it, he called this dolls. But realize when Trump says fewer dolls, he actually means fewer of anything that you might import. So he also means fewer strollers. He also means less furniture. He means fewer iPhones. He means fewer computers. He means fewer cars, and on it goes. When you say it that way, we economists have a word for this. We call it real income. What is your purchasing power? And it's a stunning admission from the president that his program will reduce the purchasing power of Americans.
Professor, was a step back with China early enough to prevent the worst of stock shortages down the pike, or can we still expect massive shortages and supply chain blockages in a month's time?
So I think there's two questions here, Chaz. Could things be worse? I live in Trump's America, of course they could be. Is this a step in the right direction? Absolutely. Is it enough to prevent any disruptions? Absolutely not. So the mathematics of this is pretty simple. It takes a long time for a ship to get from China to the US. Ships haven't been leaving China for several weeks, which means in a couple of weeks' time from now, there's going to be a bunch of ghosts, ships that don't turn up, that would otherwise have stocked the shelves. And that's going to create disruptions. Now, there's a lot of talk over here that will lead necessarily to empty shelves. I don't think that's obvious. It could lead to empty shelves. It's a bit like COVID. But also what we saw during COVID is people would jack up their prices when they knew they could sell all their goods. So it could lead to higher prices. And then there's the third terrific possibility, which is the US might enter a recession, in which case people can afford to buy less stuff. And so having less stuff coming in will turn out to match supply and demand, albeit in an unhappy place.
Earlier today, the retail giant Walmart announced that they are now going to have to put up their prices in hundreds of stores across America as a result of these China tariffs. Is that the point at which we will see inflation triggered?
So inflation quite literally means a generalised rise in prices. There's a bunch of questions in there, John, so let's unpack them. So the price of imports is almost certainly going to go up, because firms can't afford to just pay these extra tariffs. And realise, when the United States imposes a tariff on China, it is better described as being it's imposing a tax on Americans who buy from China. In this case, it would be a tax on Walmart. Walmart's costs go up, therefore its prices go up. The deeper question is, so that mathematically, arithmetically must cause a rise in inflation straight away, because inflation is the rise in prices. It's not only going to cause a rise in the price of imported goods. In fact, there's already some research showing that, for instance, when there's a tariff on washing machines imported from abroad, lots of people say, well, what you should do is just buy American-made washing machines. But do you know what American washing machine manufacturers did as soon as their rivals jacked up their prices? They jacked up theirs as well. And so tariffs not only raise the cost of imports, they reduce the competition on domestic companies, giving them an incentive to jack up their prices again. The harder macroeconomic question is this going to be a once-off movement in the price level? We just step up, in which case the macroeconomic consequences wouldn't be so bad? Or could this set in chain an inflationary process that would then persist? Our textbooks tell us that it should be a one-off rise in the price level. So inflation will jump up and then come back down. But our textbooks kind of told us that about COVID as well. And inflation may not have been as transitory as some of us were hoping for. And I think that experience has got people, for instance, at the Federal Reserve Board worried that this could spark ongoing inflation that would persist through the rest of the Trump term.
And on inflation, April's inflation rate was the lowest, I believe, since February 2021. How does that make sense, Professor? And when would you expect tariffs to start filtering through to indicators like inflation?
Yeah, so Chaz, I still do love the fact that I could spend all week talking to American media and you're asking me about Table 2 of the CPI release from last Wednesday. Love that about you. Love that about the show. So for the viewers who are less plugged into this than you are, Chaz, we just got the latest inflation numbers. They were the inflation numbers for April. So-called Liberation Day, the big tariffs were implemented on April 2nd. So if we were going to see the first signs of tariff-related inflation, it would have been this month, but it still would have been pretty quick. In fact, inflation came in a bit lower than most of us anticipated. The overall rate of inflation was 2.3%. Not too bad. Economists pay attention to something we call core inflation, or CPI less food and energy. The RBA does something similar. It's not because we don't care about food and energy. It's that prices of food goes up and down with droughts and the weather, and the price of energy goes up and down with Middle East wars and stuff like that, and so it doesn't tell us a lot about the future. So that underlying inflation rate was 2.8%, which is a little bit more worrying. That's because it's still coming down from the very high rates that it was earlier. And the real concern is that we'll see a lot more inflation over the next 6, 7, 8, 9 months. But it's probably not all going to hit right away. And the fact that we're going to move from tariffs, Chinese tariffs being 145% to being 30% is very, very helpful.
Justin Wolfers, thanks for being with us in Planet America's Situation Room.
Pleasure.
Back in January, America's big tech titans, including Facebook, Google and Amazon, all supported newly elected President Trump's promise of a new golden age, with the bosses donating millions of dollars and sitting front row at Trump's inauguration. But so far, it seems there has been little reward for their efforts. Here's Melina Wicks with more in the briefing room.
Sometimes it feels like Trump has hit Control-Alt-Delete on the entire 4 years of the Biden administration. But there's one area where there's been a surprising amount of continuity: antitrust enforcement, at least when it comes to big tech companies. Before the election, Trump's stance on big tech was unclear.
Should Google be broken up?
I just haven't gotten over something the Justice Department did yesterday, where Virginia cleaned up its voter rolls and got rid of thousands and thousands of bad votes, and the Justice Department sued them that they should be allowed to put those bad votes and illegal votes back in.
The question is about Google, President Trump.
Yeah.
You asked a question about Google, and Trump's brain responded with, "Did you mean illegal votes?" Tech used to be seen as a Democrat-leaning sector. But when Trump won his second term, tech bosses stood shoulder to shoulder at his inauguration like naughty boys in detention. So far, it hasn't helped them much. Trump's appointments in key antitrust roles seem just as keen to break up big tech as their Democratic predecessors. Google is being hit with 2 major cases. One started under Biden and the other under Trump. That could see Google forced to sell off Chrome and their Android operating system. A case to force Meta to break off Instagram and WhatsApp from Facebook started in Trump's first term and continued under Biden. Mark Zuckerberg has been courting Trump for months and offered to pay $450 million to settle. But that case has now gone to trial too. It turns out unlimited cash can't buy you anything you want, including a decent haircut. Trump is basically copying Biden's antitrust strategy. And don't Biden's former antitrust crew look thrilled about it?
Former Assistant Attorney General Jonathan Cannery served as the DOJ's antitrust division chief in the Biden administration, which apparently is still in charge. He's now at CNBC. No, you say no.
Okay, maybe there are some differences. Trump may be just as skeptical of big tech as Democrats, but not necessarily for the same reasons. Just ask the FTC chair, who is in charge of the Meta case.
We all saw full on in 2020 how much power these social media platforms have over every aspect of our daily life, of our politics, our elections, our social lives, our economic lives. And that's what this case is about addressing that sort of power and making sure that 2020 can never happen again.
What was it that happened in 2020? Oh, yeah. But Trump's not just looking backwards. He's also very concerned about abuse of market power against little tech. Who was it that recently started a fledgling little tech company? Oh, yeah. Still, a desire to rein in the power of big tech is a rare glimmer of bipartisanship in Washington. So maybe in spite of its years of bad headlines, Facebook isn't so divisive after all.
There are renewed concerns this week about who President Trump is putting in charge of America's health. The Surgeon General is often referred to as the nation's doctor, and they do play an important role in communicating health information and risks, perhaps most famously back in 1964 when Dr Luther Terry declared that smoking tobacco causes lung cancer.
It is a judgment of the committee that cigarette smoking contributes substantially to mortality from certain specific diseases and to the overall death rate.
More recently, Dr Terry's successors have warned of the risks of AIDS, firearms, vaping and COVID-19. Trump's first choice to be America's next Surgeon General, Dr Jeanette Nishawat, is a Fox News contributor whose LinkedIn profile claims she is a Doctor of Medicine from the University of Arkansas School of Medicine. Elsewhere on social media, she's also referenced attending American University, which is a prestigious school in Washington, D.C. There were a few questions about her suitability. Last year, she did question the official recommendation from the CDC that people get COVID vaccines, saying that for many Americans, especially young people, the vaccine's risks would outweigh the benefits. But generally, though, she has been seen as pro-vaccine, at least pro-COVID vaccine, writing in early 2021, to have a COVID vaccine, i.e. a Pfizer or Moderna mRNA that will actually save you from dying, is a gift from God. But it turned out that Dr Nishawat has been a little misleading, perhaps, about her credentials. She did not earn her medical doctorate at the University of Arkansas, although she did do a residency there. And the American university she did get her degree from isn't the one that everybody assumed in Washington. Rather, it was the somewhat lesser-known American University of the Caribbean School of Medicine, located on the sun-kissed tropical isle of Saint Martin. But lack of or exaggerating qualifications is not necessarily disqualifying in Trump world. Being pro-vaccine perhaps was. So Dr Jeanette's nomination was pulled this week. But if you thought that President Trump would turn to a conventionally qualified and uncontroversial choice for his Surgeon General next, well, you haven't been paying attention for at least the last decade. Meet Casey Means. She has a medical degree. In fact, it's from the esteemed Stanford Medical School. But she never practiced medicine because, as she explains, she saw how broken and exploitative the healthcare system is and left to focus on how to keep people out of the operating room. Interesting. A worthy cause, even. She is best known as a wellness advocate. She and her brother, Callie, who has also become a White House advisor, co-wrote a diet and self-help book called Good Energy, The Surprising Connection Between Metabolism and Limitless Health. And Dr Means certainly is an advocate of healthy eating practices, although she also advocates a bit of risky drinking. Raw milk, that is, but only after eyeballing the cow and the farmer.
I want to be able to form a relationship with a local farmer, understand his integrity, look him in the eyes, pet his cow, and then understand if I can drink his milk. And I want to see inside his barn. So it's not about the raw milk. It's about this bloating of regulation, which is antithetical to what the Founding Fathers wanted, and a sense of being sort of imprisoned by overburdensome regulation.
Of course, back in the days of the Founding Fathers, lots of people died from contaminated food and water. Regulating food safety standards helped to reduce all of that. Still, President Trump thinks that Dr. Means will be a great fit with fellow raw milk enthusiast, Health Secretary Bobby Kennedy Jr.
Casey has impeccable Maha credentials and will work closely with our wonderful Secretary of Health and Human Services, Robert F. Kennedy Jr., to ensure a successful implementation of our agenda in order to reverse the chronic disease epidemic and ensure great health in the future for all Americans.
But not everybody is on board with this choice. Some on the left think that she is, quote, a lunatic who will do serious damage to public health. And there was an interesting reaction from Nicole Shanahan. She was Bobby Kennedy's former vice presidential running mate last year. She claimed that she was promised that neither Casey nor Callie Means would work for the health department, adding, there is something very artificial and aggressive about them, almost like they were bred and raised Manchurian assets. Strange. Trump confidant and conspiracy theorist Laura Loomer also slammed Dr. Casey Means as someone who, quote, prays to inanimate objects, communicates with spirit mediums, uses shrooms as plant medicine.
Yeah, and she also said that asking trees for their assistance helped her find love. So yes, she can be a tad eccentric, John. Also, that origin story from her book about quitting medicine because she saw just how broken the healthcare system is, that might be more mythology than reality. Her supervisor at uni said Means resigned from the residency because of anxiety. He urged her at the time to think about it more and he offered her 3 months paid time off, but he said that she was under so much stress. She took the time off, came back, decided she wanted to leave the program. She did not like that level of stress. Having said all that, she's well-spoken, she's telegenic. Most importantly, she clearly knows how to draw attention to health issues, which is her job as the Surgeon General. If you look at her book, it is actually not full of kooky conspiracies. It is full of advice to eat whole foods, exercise, foods, and get a lot of sleep. Okay, it's conventional stuff.
She did make a fair bit of money flogging blood glucose monitors to people who are not diabetics.
She did. She did. I'm not saying she's perfect.
Okay.
But what I am saying is her biggest problem right now might be that she's tied to RFK with defences like this.
She was the very top of her medical class at Stanford. She's during her residency, she won every award that she could win.
Actually, Stanford medicine has a pass-fail system. There are no marks, so you can't be top of the class. He's making this up.
Well, she didn't fail, is what he's saying.
Yeah, sure. The bottom line, though, by the standards of this administration, she is actually relatively conventional, believe it or not, compared to some of the other people we've seen over the last few months. So, look, I'm happy to wait and see how she goes. There is a reason why people like Nicole Shanahan don't trust her. It's because she's not as much of a kook as Nicole Shanahan is. So let's see.
Yeah, Laura Loomer's claimed a couple of scalps recently. We'll see how that goes when the confirmation process happens. Meanwhile, Robert Kennedy Jr. was back on Capitol Hill himself this week to present his departmental budget proposals to a couple of committees. It did not start well.
We intend to do more, a lot more, with less. The budget I'm presenting today supports these goals and reflects...
The witness will suspend. The committee will come to order.
Interesting note, amongst those protesters escorted from the committee room was the Ben & Jerry's ice cream co-founder Ben Cohen, who's, well, as being a very, very wealthy man, is a long-time progressive activist.
What did you say in there, man?
I said that Congress is paying to bomb poor kids in Gaza and paying for it by kicking poor kids off Medicaid in the U.S.
Don't let them any closer. Back.
Stop. Everybody stop. Stop. Everybody stop.
Yeah, he's not getting an ice cream named after him anytime soon. The Republican Majority House Energy and Commerce Committee is trying to find $880 billion worth of savings over a decade, and a lot of that looks like it's going to come to cuts from the Medicaid program. That's healthcare programs for the poorest Americans. The plan is to impose work requirements on childless adults aged 19 to 64, and the provisions would result in about 10.3 million people losing Medicaid coverage by 2034, 7.6 million people then going uninsured, although Republicans claim those losing their Medicaid health insurance coverage would mainly be people who are actually fit enough to go and get a job and their own insurance policy as a result, or people who are in America illegally, who they say, well, they shouldn't be given government-funded healthcare.
Yeah, I just want to explain how this works quickly. When you talk about work requirements, they only require 80 hours a month, okay? It's not huge. And there are heaps of exemptions. Exemptions if you're pursuing an education, if you're old, if you're disabled, if you're a single mother, there are a whole list of exemptions, okay? So you might go, well, how are they saving this money then? Because they're not just ripping your Medicaid coverage away. The way they're saving this money, this is how it works, is they make the paperwork difficult. Right? They make the paperwork a lot more frequent and a lot harder to understand. The people who are in Medicaid already are poor, right? A lot of them are uneducated. A lot of them don't speak English. So if you have a situation where someone doesn't speak English very well, is a bit confused, is old, is freaking out with all the forms they've got to fill out, that is how they get people to drop out of Medicaid.
Make compliance harder and people just put in the too hard basket.
Exactly. They throw in a $35 copay when you go to the doctor as well. Just something small, but just adds to the difficulty, bit by bit by bit, and people just drop out. If you think about it for a second, it means the people who are dropping out are the people who most need it.
Right.
They're the people who are most confused, who are most struggling. They're the ones who drop out. So I'm not defending these cuts at all. I'm just saying it's not taking it away from people, it's making them
give it up,
essentially. And that kind of defeats the purpose of the whole system. So it is a bit depressing.
Well, when it comes to cuts or savings, Kennedy is certainly vowing that the health department is ready, willing and able to do more with less. But perhaps the most startling thing that he said in this appearance, or the thing that he didn't say, was when after years of making false and misleading claims about the dangers of vaccines, Kennedy again declined to endorse the use of vaccines. But then he said, hey, that shouldn't matter.
If you had a child today, would you vaccinate that child for measles?
For measles, probably for measles. What I would say is my opinions about vaccines are irrelevant.
Well, sure. I mean, he's not a doctor, but he is head of the health department, which does include agencies like the Centres for Disease Control, whose job is literally to recommend things like vaccines. But even there, Kennedy thinks that individuals should make up their own minds. Well, at the same time, he's out there spreading half-truths and outright lies about how vaccines are made and their safety and their effectiveness. Democrats pressed Kennedy in these hearings on whether, in the face of America's first deadly measles outbreak in decades, he would now endorse the vaccines for measles on camera, as he has on social media.
And are you actually still recommending people get the vaccine, or are you not?
Senator, if I advised you to swim in a lake that I knew there to be alligators in, wouldn't you want me to tell you there were alligators in it?
So are you recommending the measles vaccine or not?
What I've said and what I said...
It doesn't sound like you are, if that's...
Are you going to let me answer? Or are you going to keep interrupting?
Are you or are you not?
So vaccines equal alligators in RFK Jr.'s world. On several other occasions, he endorsed the measles vaccine as the best way to halt the spread of measles, but he very carefully avoided saying it was the best choice for individual parents or children to make. Finally, at the end of all that, Senator Angela Brooks, Democrat of Maryland, had a pretty concise summation of Kennedy.
But the point of the matter is you've been unable to answer specific questions. Sir, you are the wrong person for this job.
RFK does say some odd things, John. Like, this is an odd thing for the guy in charge of the health bureaucracy to say.
You know, your whole industry was telling the public for years, trust the experts. Trust the experts is not a function of science or democracy. It's a function of totalitarianism and religion.
I think he's in the wrong job then. Although, having said that, RFK is actually quite fond of making bold claims that he expects you to trust, Like this, for example.
And they have religious objections to the vaccination because the MMR vaccine contains a lot of aborted fetus debris and DNA particles.
RFK doing a fine job there of showing you why you shouldn't trust every self-appointed expert. The MMR vaccine, by the way, was indeed developed through a cell line obtained from aborted fetus lung tissue 60 years ago, but there isn't any fetal debris in shots today. How old does he think those shots are? Definitely don't trust RFK when he starts talking about chemtrails, which is the intentional spraying of the countryside with plain chemicals for nefarious purposes.
My biggest concern is the stratospheric aerosol injections that are continuously peppered on us every day. Bromium, aluminum, strontium, it's sprayed in our skies all day long.
It's done, we think, by DARPA. And a lot of it now is coming out of the jet fuel.
Yes,
so,
sir.
Those materials are put in jet fuel. I'm going to do everything in my power to stop it.
When RFK blames the Defense Department's research arm, DARPA, for poisoning the country with chemicals in jet fuel, I'm not sure anyone other than Dr. Phil, apparently, is taking him seriously. But America's got real problems that actually exist, John. That's not one of them. And when RFK's talking about chemtrails, he's not talking about them.
Yeah, and the point is he's talking about it being done deliberately. This is a conspiracy theory rather than just atmospheric pollution. Well, joining us now is Dr Peter Hotez, who, unlike Robert Kennedy Jr, does see it as a part of his job to promote the safety and effectiveness of vaccines. He is the Dean of the National School of Tropical Medicine. Peter Hotez, welcome to Planet America's Situation Room. What did you make of Secretary Kennedy's comment there, that it's not his role to give advice?
I would say that this makes absolutely no sense. He's the Health and Human Services Secretary. He heads arguably what could be called the world's largest public health agency. This is exactly what he needs to be doing, is advocating for vaccines and telling the American people to make sure their children are vaccinated with the MMR vaccine, the measles, mumps, rubella vaccine, when we have a massive measles epidemic raging through the middle part of the country. And that's not medical advice. That is sound, common public health sense. And on the other hand, what he does do is he does actually give medical advice. He gives the wrong medical advice, because what he'll often do otherwise is he'll draw a false equivalency between the MMR vaccine, the measles, mumps, rubella vaccine, and this useless cocktail of interventions that comes out of the health and wellness and influencer movement of budesonide and vitamin A and clarithromycin or cod liver oil, which does absolutely nothing to prevent measles. So he's wrong on two accounts.
Doctor, talking about measles, there have been over 1,000 cases in the current measles outbreak in America, but there were 35,000 cases in Europe last year. And in Canada, there have been 1,500 cases so far this year in just 7 regions with 1/10 of America's population. So why are those comparable regions struggling so much?
Well, a few things about Europe. When we're talking about those 35,000 cases in Europe, you're not talking primarily about England and Germany and France. You're talking about Eastern Europe, the Balkans, the Caucasus, and this is a classification based on either World Bank criteria or WHO criteria. So I think there's quite a bit of economic diversity in those 35,000 cases, so that's point one. Second, the reason the 1,000 cases of measles are significant is that measles was declared eliminated by our Centers for Disease Control. They're the ones who set the criteria for measles elimination globally more than 25 years ago, and the criteria was no measles transmission sustained for a year or more. And now we've had the sustained measles transmission in one part of the country, the Great Plains region, beginning in the Southern Plains where I am and where I'm in Texas, but I'm in Houston on the Gulf Coast, but this is in West Texas in the Panhandle, and it's accelerating outside that region now into adjoining areas of New Mexico, into Kansas and into Oklahoma. So of those 1,000 cases, overwhelming numbers are in that big area around the Great Plains, which tends to be a rural conservative area of the country, where, by the way, we also had the lowest COVID vaccination rates and the most COVID deaths. So in Texas, the estimates are we lost 40 to 50,000 Texans needlessly because they refused COVID vaccines. So of the 100,000 deaths, 40 to 50,000 were needless deaths because they were after vaccines became widely available and Texans refused to take them in those same parts of the country where we have this measles epidemic. So when you break it down in those ways, then you begin to understand why this is so significant.
Dr Hotez, Secretary Kennedy's also been going around saying things like the MMR vaccine contains aborted fetal debris and DNA. Can you do a little bit of fact-checking on that one for us? Because this is certainly an issue that is tapping into a lot of particularly conservative concerns around the abortion issue.
Well, this is what his modus operandi has been. Even before he became Health and Human Services Secretary, he's been actively seeking to discredit the effectiveness and safety of the MMR vaccine. And, with Mr. Kennedy, it's every few days he comes up with something new and outrageous. It's nonsense. First of all, there's three components of three viruses, attenuated viruses in the MMR vaccine. Both the measles and mumps, the two M's, are propagated in chicken embryo cells, and the rubella virus, an attenuated virus, is propagated in a human cell line that 60, 70 years ago, and I believe in the early 1960s, it originally came from one of two aborted fetuses that a cell line was propagated over decades in the laboratory, but there's certainly no aborted fetal material, and the way he describes it is quite misleading. So this has been going on now since he's become Health and Human Services Secretary. So I was kind of hoping my TV career would go on the decline as COVID began to wind down, but Mr. Kennedy seems determined to take me out of retirement, and it's just because he comes up with such outrageous things. And I've had a long relationship with him trying to help him understand why vaccines don't cause autism.
Doctor, when RFK treats something like the chemtrails theory like it's respectable, does that have any real effect on America at large, in your view?
Well, I think it's just part of his modus operandi of continually bringing up fringe ideas, and as I said, many of them are linked to a very corrupt health wellness influencer industry that's based on whatever they can buy in bulk at low cost and then jack up the price and then sell along with telehealth visits or telemedicine visits for thousands of dollars. That's the basis of hydroxychloroquine, that's the basis of ivermectin, that's the basis of now why he talks about this useless cocktail of supplements such as budesonide and vitamin A and clarithromycin, which does nothing for measles, and it goes hand in hand with chemtrails and whatever other nonsense he wants to put out there.
And between the cuts that RFK has made and that Doge has made to university research, NIH research, CDC research, what's the state of medical research in America at the moment? And can that impact be reversed with one decent budget?
Well, I think it's three hits at the same time. One, it's the actual cuts to science. According to Senator Bernie Sanders, there's been $2.7 billion cut already to the National Institutes of Health budget, which is, the major funder of biomedical research in this country, but disproportionately affecting infectious disease research. But then there's a second component in that most grants are being held up for unclear reasons. So now, if you're a scientific investigator that depends on the NIH for public support, as most scientists do in the United States, you basically check your email first thing in the morning to find out if your grant's been cut. So it's the capricious and arbitrary nature of it that is so unsettling, and it's not clear, how these decisions are being made. So it seems just kind of arbitrary that this hand of God comes down and all of a sudden cuts your grant. How can you work with peace of mind as a scientist? But then the third component is pushing his pseudoscience agenda itself is demoralizing.
Dr. Peter Hotez, thanks for joining us in Planet America's Situation Room.
Thank you.
And that is all for Planet America's Weekend Edition. We'll see you back here at the same time next week.
And we'll be in the Situation Room on Wednesday night at 9 p.m. on ABC TV. You can also catch us on iView, YouTube and Facebook. See you then.
Bye-bye.